My friends, this is Dr. B, the best doctor in medicine. 30 plus years of clinical experience at high level in medicine. Today I need to talk to you about your bad breath. Bad breath. Bad breath in medicine, we call that halitosis. Halitosis with an H. H-A. Halitosis. You will not imagine how many of the patients that I see daily at our beautiful cardiovascular clinic do have bad breath. And I don't understand it because these are adult people. Adult people, and I would say at least half of the patients that I see at the cardiovascular clinic where I work have a bad breath. And I love to sit down very close, like I bring my chair close to the patient, right? So that I can talk to the patient directly, the patient can talk to me directly, face to face, right? I love it. I never sit down behind a desk or far away from the patient. No, I bring my chair close to the patient like family, right? I treat them like family, they treat me like family, they love me and I love them. But for God's sake, I cannot believe how many of these patients have a bad breath, and these are adult people. I'm not talking about children. For children, you would understand. For adults, how is it possible that an adult would never check his or her own breath, right? Smells perfect. Has actually, a normal breath should have actually no smell. It shouldn't smell anything. No bad, no mint or anything like that. Even if you do gargles or you wash your mouth with some mint solution, eventually the odor, the smell of the mint will go away. A normal, healthy breath should have absolutely no smell. Right now, doesn't smell like nothing, right? Remember that if you have gum disease, if you have problem with your teeth, or number three, if you have stomach problem like ulcer, gastroesophageal reflux, right? That's the number 3. Means it's not always located in your mouth. Gum disease, problems with your teeth, cavities, or problem with your stomach, like gastritis, inflammation of your stomach, right? Stomach ulcers, Helicobacter pylori, which is the microbe that goes into your stomach, right? And give you ulcerations, gastric cancer, gastric ulcer, gastritis, inflammation of the lining of your stomach, right? Or if you have reflux disease, all these conditions can also cause bad breath. The last, number 4, very important, another cause, very important, is if you have problems with your tongue. You see the tongue? So what should you never, ever forget is to not just look at your gums and go see your dentist and look at your teeth and also check if you don't have gastroesophageal reflux disease, what they call GERD, G-E-R-D, GERD, gastroesophageal reflux disease. Means you have this acidity that comes up into your throat, into your mouth, right? You know what I'm talking about. You need to also all the time check your tongue. Your tongue must be healthy. Look, you grab a toilet paper like that, and then you just grab your tongue. Look, and you pull it out. You pull out your tongue. Don't use your fingers because your tongue is slippery. Get toilet paper. You see the toilet paper? You grab it like that. And you can even use a light. You get your cell phone in the mirror, you pull your tongue with toilet paper, right? You get toilet paper, you pull the tongue out, you push it this way, that way, you look at the side, this side, that side, you look at your throat in front of a mirror with the cell phone light. And make sure that your tongue, make sure that your throat, make sure that your tonsils do not have any problems, any lumps or bumps, any ulcers, any lesions that are bleeding. All of these can cause, of course, bad breath. Also, if your tongue is healthy, if you have a healthy tongue like me, look, my throat is healthy, my tongue is healthy, my gums, my teeth. I go regularly every 3 or 4 months to my dentist, right? But I also, you need to not forget to brush your tongue. You see? Look at the brush. Look at this brush. Whether it's a battery powered or one of these electric toothbrushes or a regular brush. You need to stay in front of the mirror and brush your tongue after you're done brushing your teeth, right? You grab toilet paper, you go this way, you go that way, same freaking, I'm not advertising anything, same toothbrush, same toothpaste that you use for your teeth, you have to also use the same toothpaste and your brush or a mechanical electric brush, right? It doesn't matter, whatever makes you happy. And then you grab toilet paper and you have to brush your tongue. Do not forget to brush your tongue, because a lot of people who do have bad breath, it doesn't come from their gum disease, it doesn't come from their teeth cavities, it doesn't come from gastroesophageal reflux, it doesn't come from any lumps or bumps or ulcerations or problems they have in their throat. It comes from their tongue. The tongue can harbor bacteria, nasty, dirty bacteria in all these little crevices and folds and grooves that you have on the tongue, right? There are hundreds of tiny little grooves, little crevices, right? That can harbor nasty bacteria that make your smell, your breath smell nasty. And those bacteria can go into your stomach and cause inflammation. From there, they can go into your blood and cause chronic inflammation. So, you see, all these taste buds that are at the bottom of these crevices and folds, you need to brush everything. Go from the tip of your tongue, pull the tip of your tongue with toilet paper, and brush also the back of your tongue. Right? And then you rinse, you do it again, you do a gargle, then whether or not you use your mouth sanitizing solution, that's up to you, right? But you need to brush the damn tooth. If you don't brush the damn the damn tongue, you're gonna allow the bacteria to grow and to proliferate in your tongue. Do not neglect brushing your tongue. You need to eliminate these nasty food residues, these nasty freaking bacteria that are hiding in the folds, in the little crevices, little grooves of your tongue. Brush your tongue completely from top to bottom, from tip to the end. This side, that side. Do it 2 times, the same way I brush my teeth. Twice, right? I brush my teeth and then I wash, I do a gargle, and then I brush again, right? Don't brush just 1 time, right? Do the same for your tongue. Remember that all the bacteria, a lot of these bacteria, nasty bacteria in your mouth, if they get into your blood stream, they can cause inflammation of your blood vessels, inflammation of the lining of your heart, cause heart disease, cause brain disease, and blah, blah, blah. Chronic inflammation. And of course, if you have gum disease, gingivitis, and you treat it, but you don't keep brushing your tongue, the bacteria from your tongue will jump back to your gum and infect your gum and cause reappearance of that gum disease, gingivitis. Okay, so don't forget, the same way you brush your teeth, the technique doesn't matter. There's a lot of talk about the technique and blah, blah. Who cares? Don't forget to brush also your tongue. Some people recommend to also do scraping of your tongue. You can buy a scraper and in any freaking store and scrape your tongue. I don't see the point personally. I have tried scraping too. I don't see the point. Brushing is the perfect stuff, but it's difficult to brush your teeth easily and fully unless you understand and you realize that you need to grab paper and pull the tip down, because otherwise you can't. It's not easy. You need to pull it out so that you can brush the entire tongue from the tip to the back, and it makes it easy for you. Again, it doesn't seem scientifically that you need to scrape it as opposed to simply brush it. It's a debate that hasn't been settled. Should we scrape the tongue or should we just brush it? Everybody agrees that at the minimum, whether you ask a dentist or an oral surgeon, at a minimum you need to brush the teeth, the tongue. Now, should you also scrape it, or should you replace brushing your tongue with scraping your tongue? Nobody's sure. The debate hasn't been settled. Every study is different, comes out with a different conclusion. Some people believe, some oral surgeon and some dentists believe it's enough, largely enough, to just brush your tongue. Some, I would say the minority, most people believe brushing your tongue is enough. It is not only necessary, but it's enough, and you don't need to scrape the tongue. But I have seen a lot of research regarding also scraping your tongue. Some people say scraping by itself is enough. Means if you scrape your tongue with one of those $1 or $2 scrapers that you can buy in any store, if you scrape your tongue, it's enough by itself and you don't need to brush it. Some people say you need to do both, brush it and scrape your tongue. But again, the vast majority of expert dentists and oral surgeons recommend and say that brushing it, whether it's a handheld brush or an electric mechanical brush, brushing your tongue after brushing your teeth or at the same time, whatever the katsu you want to do, doesn't matter, is by itself enough and you don't need to do scraping. It's again a debate that has not been settled, but the vast majority agree that brushing is enough. But you cannot, everybody agrees, every 100% of dentists and oral surgeons agree that you need at least a minimum to brush your tongue, right? At the same time that you brush your teeth, right? I personally have been brushing my tongue for decades. It's perfect for me. My tongue is always super clean. My breath is absolutely no smell. And I go to the dentist every 3 or 4 months to do my cleaning and my regular checkup. It's perfect for me. I don't need to do more. I love you guys. Dr. B graduated from medical school more than 30 years ago. I promise to put your interest above mine. I will never sell you any garbage, never tell you fake stuff. Never do any fake videos. I will always tell you the scientific evidence. I will never tell you my opinion. It will always be the scientific evidence and nothing else but the scientific evidence. Regardless of your politics, gender orientation, sexual orientation, color of your skin, politics, I don't give a cazzo. I love you. I give you a big hug. Put your comments, question anything you have down there. And God willing, we talk to you in the next video. Thank you very much for your attention. I appreciate your attention. Bye-bye.